Today we are discussing about the new treatment in the case of type 2 diabetes mellitus, that is once weekly injection. As the name suggests, this is needed to take once in a week. This Trulicity injection, the salt is 𝙤𝙧𝙪𝙡𝙦. 𝙤𝙧𝙪𝙡𝙦 is a GLP-1 agonist. Like the other GLP-1 agonist, the mechanism of action of 𝙤𝙧𝙪𝙡𝙦 is same. It decreases fasting as well as the postprandial blood sugar. How it works? 𝙤𝙧𝙪𝙡𝙦, it increases the insulin secretion, it decreases the glucagon secretion, and the most important, it decreases the gastric emptying. By these three important mechanisms, it decreases the blood sugar values. Now, what kind of patient we need to choose while starting the 𝙤𝙧𝙪𝙡𝙦 or the Trulicity? So, it can be given to the patient with HbA1c more than 7.5, or you are seeing that the fasting and PP, if both are coming high, you can go straight away with the 𝙤𝙧𝙪𝙡𝙦 injection. So this was about the mechanism of action and the right patient to be taken. And what about if the patient is on the long acting insulin? Yes, we can shift with the patient on the Trulicity once weekly injection. If the patient is on pre-mix insulin, yes, we can shift on 𝙤𝙧𝙪𝙡𝙦. If the patient is on co-formulation, yes, we can shift. If the patient is on basal plus and the basal bolus therapy, you can give the patient 𝙤𝙧𝙪𝙡𝙦 or once a week injection, but in that condition, you need strict monitoring that after 𝙤𝙧𝙪𝙡𝙦, check properly the blood sugar values, whether the blood sugar are coming in target values. It is very going to be convenient for the patient when he apply weekly. And along with the 𝙤𝙧𝙪𝙡𝙦, the beauty is that if the fasting or the PP are not coming in control, you can add the long acting or you can add the short acting insulin according to the patient rating. The Trulicity, the beauty as we are seeing that this Trulicity injection, it is a pen, comes in pen form. So this comes in the two doses form, that is the 0.75 mg and the 1.5 mg. So first 15 days it is better to be go with the 0.75 mg and then gradually increase the dose to the 1.5 mg, because the side effect of the Trulicity always doctor should keep in mind, that is the Trulicity can cause the nausea, it can cause abdominal bloating, abdominal disturbance, to the some extent it can be create the constipation. Nausea is the more troublesome adverse event, and it depends, severity depends and vary from patient to patient. So if we see 15 days we use a 0.75 mg, we can see the patient, if the patient tolerate well this dose, and then we can increase the dose if required to the 1.5 mg. This kind of side effect like nausea and abdominal disturbance, we can decrease by asking the patient that don't eat when he feel full, or avoid some kind of fried kind of foods, and small meal and frequent interval is the key of success. So this is all about the Trulicity, and the Trulicity is a beauty, it has a hidden needle. So when you apply it, first make sure unlock this pen and then you apply. This is, as you can, again you can see on this slide, you will able to understand in a proper way. Like this is, you are able to see this pen, and then it is needed to unlock first and then press. Then on the abdominal side, as the subject is applying, you can see the press and hold, and then you can see this mark. So by this Trulicity once weekly injection, and by proper monitoring, if you apply along with the Trulicity injection, you apply the glucuride, that is the continuous glucose monitoring, and see your glucose value, then you can get the very good glycemic control. So thank you so much. Any query, just leave in my box. Thank you so much.